In this video we're going to be thinking about the blood vessels, considering the arteries and the veins, and we're going to try and learn about the blood vessels by looking at the differences between the arteries and the veins. But before we do that, I just want to talk a little bit about the two sort of circulatory systems in the body. And we've made a note of this on top. Firstly, there is the systemic circulation, and then there is the pulmonary circulation. Now, the systemic circulation is taking blood from the aorta, pumped out by the left ventricle, to all the systems of the body. So it goes to the brain and the spinal cord and the kidneys and the liver and the hands and the feet. It basically goes everywhere except the lungs. So the systemic circulation is perfusing all the systems of the body. But the pulmonary circulation, from the right ventricle, the blood is leaving the pulmonary artery and is going to the lungs only to be oxygenated. So we're going to look at arteries and veins, and we're mostly going to be considering systemic arteries and veins, but as we go along we will point out one or two of the minor individual differences between the pulmonary and the systemic circulation. And the thing to start off with is remarkably easy, remarkably straightforward. An artery is simply any vessel that carries blood away from the heart. It is that simple. So an arterial vessel is carrying blood away from the heart. That is always true. So a vein is towards. It's as simple as that. A vein is any vessel carrying blood towards the heart. That is the definition of these vessels. Arterial vessels taking blood away, veins bringing blood back towards the heart. And that's true whether we're talking about the systemic or the pulmonary circulation. Now, arteries do not have valves. They do not have valves to ensure one-way flow. But veins do have valves. Now, the reason for this is that the blood goes through the tube of the artery under the influence of the blood pressure generated by the contraction of the heart. In the case of the systemic circulation, under the pressure generated by the left ventricle. In the case of the pulmonary circulation, under the pressure generated by the right ventricle. But the veins don't have this luxury because they're carrying blood back towards the heart. So we have to make sure that the blood only travels in that direction, from the periphery back towards the heart. And for this reason, the veins will have valves. And the valves will point up in this direction, pointing towards the heart. So what this means is that once the blood has gone from a lower part of the vein up into the next part of the vein, then it shouldn't be able to regurgitate backwards because these valves will shut. So the valve will open in this direction, allowing the blood to go from there to there. But then if the blood tries to go back towards the periphery, the valve will simply shut. And these valves are particularly plentiful in the veins in the legs and the veins in the arms. Now we want to think about the overall structure of blood vessels now. And a good way to do this is to think about cross sections of the blood vessels. So if we think about an artery here, in the middle we have the arterial lumen. The lumen is the hole down the middle of any blood vessel. And then surrounding the lumen, there's a layer of vascular endothelium, a relatively thin layer of vascular endothelium. Now, the layers of a blood vessel are like coats, the coats of a blood vessel. So they're all called tunica. They're all called tunica. And the one in the middle is called the interna. So this is the tunica interna. Some books will call it the intima. It means exactly the same thing. So that is that first layer. And then arteries are going to have a thicker muscular wall. They have a thicker layer in the middle, and this is the tunica media, mostly made up of smooth muscle and some elastic tissues as well. And then round about the outside, there's another layer called the externa. So we've got the tunica interna, or the intima, the media, and the tunica externa. And sometimes you'll see the tunica externa referred to as the tunica adventitia. The adventitia is the outer layer of an organ. And with arteries, especially the larger arteries, there is actually a couple of extra layers. Around about the outside of the tunica media, there's an extra layer that is largely elastic tissue, because the larger arteries, we want them to be elastic. That's called the elastic lamina. So there's an external elastic lamina around about there, like that. And then in the larger arteries especially, this is well differentiated, there's another elastic lamina on the inside of the tunica media round there, the internal elastic lamina. And this is made, as the name would imply, made of elastic tissue to make the arteries elastic. Then in the middle layer here, we have mostly smooth muscle with some elastic fibres, a little bit of collagen as well, forming the muscular coat of the artery. So vascular endothelium on the inside, lining the lumen to give a nice smooth flow of blood. Then the media with its elastic lamina, and then the adventitia, or the externa, around the outside. And the externa is largely elastic tissue and collagen. And in the large arteries especially, there are some small blood vessels to nourish the arterial wall, and some nerve connections as well, because arteries are actually quite sensitive to pain. When patients have arterial punctures for clinical reasons, when they're critically ill, it's quite a painful procedure. And of course the whole point of the artery is to have this hole down the middle, and this is the lumen. The lumen is the hole down the middle. So that is the cross section of the artery. The whole point is to have this lumen down the middle. Now the larger arteries are sometimes called elastic or conducting arteries, because when the heart ejects blood into large arteries such as the aorta or the pulmonary artery, the artery is going to expand with the surge, the pressure wave of blood that is ejected into those arteries as a result of the ventricular contraction. But then as the artery starts to elastically contract down again, that maintains the flow of blood and it smooths out the flow of blood. Otherwise you'd have a flow of blood every time the heart contracted, and then essentially nothing in between times. So when the heart contracts, the arteries expand, that's storing up energy, which it then elastic contraction brings that back down again, propelling the blood forward in these conducting arteries. Now in the smaller arteries, these are sometimes called distributing arteries, and they have more muscle and less elastic tissue in their walls. These are the sort of arteries that you might feel in the wrist, for example, in the radial artery. But the key thing is we have this nice clear lumen down the middle. And of course a big part of the problem in Western societies, and increasingly in poorer countries, is that these arterial lumens are getting clogged up with atheroma, the disease process of atherosclerosis. But that's what the nice healthy one looks like. So just to label this, they're all called tunica. The interna is the internal one, that one there. The media is the middle one. The externa or the adventitia is the outside one. And the lumen is the hole in the middle. Now the situation with veins is very much the same, but the walls are relatively thinner in veins because, as we'll see, the arteries need thicker elastic walls to smooth out the blood flow, and because the pressure in the arterial vessels is significantly higher. So if we think about a vein, now the pressure of the vein will depend on how full it is. They're not necessarily completely round. Veins can partly collapse depending on how full the vein is at the time. So here we have a vein, and the layers are pretty well the same. We've got the externa or the adventitia, then we've got the media. The media is relatively thinner than in the artery, and then inside we have the intima. There's the intima there. The intima is vascular endothelial cells. The media is smooth muscle and some elastic fibres. But the veins do not have the elastic lamina that the larger arteries do. So in the vein, all the layers are called tunica again. So the interna or the intima is the inside layer of vascular endothelium. The media is the relatively smooth, muscle-rich layer. The externa or the adventitia is the outside layer. And of course the lumen is there in the middle, as you would expect. And the vascular endothelium is very smooth, squamous cells, because we want a smooth flow of blood over the vascular surface. So inside there's going to be a basement membrane here, and the cells of the vascular endothelium are going to be flat cells sitting on that, each with their own nuclei, of course, and that means that the blood can flow over this without any disrupted flow. At least that's how it should be in the physiological situation. So we see that the tissues of these, the layers of the arteries and veins, are specifically engineered for the purpose that they are providing. So the tunica, interna, media, externa, lumen with the elastic lamina in the larger arteries. Now if we think about the systemic arteries, if you cut a systemic artery, we find that the blood is bright red. So you'll get bright red blood. Bright red blood from an injured systemic artery. Whereas if you cut a vein, a systemic vein in the feet or the hands or wherever, then that blood we're going to notice is going to be dark red. And very often you can look in a wound and you can see areas of bright red and areas of dark red blood. That would indicate that there is mixed arterial and venous hemorrhage. So why are there this colour differences in the blood? Well, it's to do with the amount of oxygen in the haemoglobin. Oxyhemoglobin is bright red. The reduced deoxyhemoglobin is dark red. And when we do oxygen saturations of the blood in arteries, we'll normally find it's about 95 to 100% saturated with oxygen. If the blood is 100% saturated with oxygen, that would mean that all of the hemoglobin molecules are full of oxygen. If the blood is only 95% saturated, that would mean that only 95% of the hemoglobin molecules are saturated with oxygen. But the dark red blood that can be found in veins is not fully deoxygenated. If we look at the blood in the vena cava, for example, we'll typically find it's about 70 to 80% saturated. So it's not fully deoxygenated by any means, it's just that the oxygen saturation is lower. And the reason for this is fairly obvious. It's that this blood has given up its oxygen to the tissues and is returning to the lungs in order to be fully saturated again, ready for its next trip to the systemic circulation. Now, the pressure in arteries is higher than in veins. So if you cut an artery, the blood will spurt out. So when you see an artery cut, the blood can go pss, pss. It can actually squirt out. Now, fairly quickly, the artery will constrict to limit blood supply, but initially the blood spurts out if the artery is cut. And of course, it's bright red arterial blood that we would see. And the reason for this is that the pressure in the large systemic arteries is about 120 over 80 millimeters of mercury. Systemic arterial pressure. Now, in the pulmonary arteries, the pressure is much less. So you might find that the pulmonary arterial pressure was, say, 25 over 12 or something in that. There is a range, but 25 over 12 will be a normal figure. So 120 over 80 in the systemic arteries. Blood at relatively high pressure. But in the veins, the pressure of the blood is less. So if we look at the central venous pressure, the pressure of the blood in the vena cava, for example, we would normally find that that's perhaps 2 to 6 millimeters of mercury. So we see that the pressure of the blood in the veins is significantly less, and that's why the blood will just ooze out if cut. It just oozes out if it's cut. And indeed, if you ever want to know for sure if a vessel you're examining is an artery or a vein, it's very simple. Arteries pulsate. You will be able to feel the arterial pulsations going under your fingers in an artery, whereas in a vein there is no pulses. At least there's no pulse generated by the ventricular contraction. So it's quite simple to tell the difference. And of course, the fact that arteries pulsate is very useful. We can feel them all over the body, and that gives us a lot of useful clinical information about our patients. So the blood vessels, the large blood vessels, the arteries and the veins, systemic and pulmonary circulation. Arteries carry blood away from the heart. They have no valves. They have the 3 layers, the tunica interna, media and externa, but they have these additional elastic lamina to make the arteries elastic, to smooth out the pulsations. The oxygen saturations are 95 to 100%, so the blood is bright red. The pressure's high, so it will spurt out if cut, and they will generate the pulse if you palpate them, especially if you palpate them over a bone that's nice and hard, so you can squeeze the artery against the bone. Veins carry blood towards the heart. Veins have valves, arteries do not. The walls of the veins are relatively thinner, although they still have the tunica externa, media and intima. The veins do not have the well differentiated elastic lamina as arteries do. The saturations in veins are 70 to 80%. Oxygen saturation is much lower, so the blood is dark red in appearance. The central venous pressure is only about 2 to 6 millimetres of mercury, so when we cut veins they usually ooze out if they're cut. And of course veins, we cannot palpate the arterial pulsation. So that's a little bit about arteries and veins and the differences between the two types of vessel.